Hi guys, thanks for joining me. I'm Dr. Ayele Okine and this is This Vet Wants You to Know. Today we're talking about fungal disease. This is the second part of our two-part series. So if you haven't watched the first section that talks about fungal organisms, Coccidioides and Aspergillus, hit the pause, go back, watch that, and then come back and watch this video. This is the second part of the series, and it does build a little bit off the first episode, so please go back and watch that. Also, please follow me, please subscribe, please set your notifications so that you can see the videos that I'm putting out. I plan to get a more regular schedule, but in the meantime, I'm just so excited to record all of this that I just keep posting one after the other. So please follow me, please subscribe, leave a comment, let me know how I'm doing, and also let me know if you have any ideas for content. I definitely want to make sure that I'm making videos that you guys want to watch. Not only just educating based on the things that I like, but I also want to make sure that you're getting the information you need to take care of your pet. So let's get into it. The first fungal organism I want to talk about today is Pneumocystis. This is actually a fungus that used to be classified as a protozoal organism or a parasite. It's really, really uncommon. I actually wrote a case report that's been published in the Veterinary Clinical Pathology Journal because it's just so uncommon and rare. This fungus is present throughout the environment. There appears to be different species that have an affinity for different species, different mammals, and so you can't get transmission, or it's thought to be really difficult to have transmission from people to pets or pets to people, but all of us are at risk for it in the environment. Typically, it only causes disease in immunocompromised patients, and so in people, it actually is seen with increased frequency in AIDS patients. In dogs, which is where we see it reported most frequently in the literature, it often causes a pneumonia characterized by quick breathing, but lack of a fever. And so that's what kind of sets it apart from other fungal organisms, especially Coccidioides. Interestingly enough, it's actually treated with an antibiotic, and I think that's because the structure is so similar to protozoa or parasites that one antibiotic in particular called TMS has efficacy for it. The prognosis is guarded, but often we can see that with prompt treatment, these patients can do really well and actually can be cured of their infection. I now want to talk about a fungal organism called Blastomyces. This is a fungus that's present in the soil, primarily in the Midwest to kind of East Coast, Southeast, those areas. We can sometimes see it in the West Coast, but usually there's a travel history, not always. It primarily, again, affects dogs, rare in cats, but we do see it. This fungus can cause not only pneumonia, but also can affect the lymph nodes that are in the chest. It can affect lymph nodes that drain into the skin, lymph nodes all throughout the body. We also can see it cause skin lesions. It can actually affect the bone. So one of the big differentials for bone that has been eaten away by something is fungus, so Blastomyces, and then also cancers can do that as well. This sort of fungus often does cause a fever. These patients really don't feel well, and again, that's because in a lot of cases we find it in more than one place, not always. It also can cause upper respiratory symptoms as well, and so that would be another rule out for patients that have upper respiratory disease. The diagnosis for this fungus often comes with, obviously, imaging. We want to know where the lesions are located, and then trying to get a cytology sample or biopsy is going to be helpful. Antibody testing can be done for Blastomyces as well, however, it's not super reliable. It's one of those tests that if it's positive, you often can believe it, If it's negative, it really doesn't help you either way. It really doesn't rule it out. So a positive test is a lot more helpful than a negative test. We also can do what's called a tracheal wash or bronchoalveolar lavage. And what that is actually under either sedation for the tracheal wash or general anesthesia for the bronchoalveolar lavage. We actually can instill a little bit of saline either into the upper airways with the tracheal wash or down into the basically the last part of the lungs, the alveoli, which are kind of where the air and oxygen is kind of moved from the air into the lung tissue and then the bloodstream. The bronchoalveolar lavage we actually get with bronchoscopy, so that again does require general anesthesia because we're going really deep into the airways. The tracheal wash, because it's actually done with a small catheter into the windpipe, that can be done under some sedation. But by instilling a little bit of sterile saline into those areas and sucking as much of that out as possible, we will get any inflammatory cells, any bacteria that may be there, and then any fungal organisms as well. The other ways that blastomycoses can be diagnosed is either by doing DNA testing, so PCR testing to see if the organism is there, or what's actually a bit more common and a little less invasive is doing a test, an antigen test, where basically you're looking for bits of the fungus actually in the urine. That's the primary area, kind of the best area to find it. You also can look in the bloodstream as well, but the urine is really where we want to go. This test also does cross-react with another fungus that we'll talk about later called Histoplasmosis. And so if you get a positive, it could be either one, but again, most often it's going to be blastomycoses. Treatment involves antifungal medications, whether that be oral, if the patient's more stable, or injectable. And again, this is a disease where we're often treating long-term or even lifelong. And in some cases, if it's in the bone and we can't get the infection under control, sometimes surgery to actually remove that affected area is the treatment of choice. So again, this is something that during my residency when I was in Ohio, I saw quite a bit of this disease. Histoplasmosis is another fungus that we see in both cats and dogs. If I think about it, probably saw more cats than dogs with it, but we can see it in both species. In cats, it often is disseminated, meaning it's found throughout the body. In a lot of cases, skin lesions are what brings them in, but we can see it in the lungs, we can see it in the gut, we can see it in the spleen, we can see it in the liver, etc. In dogs, it can be respiratory, primarily in the lungs, or it can be disseminated with lung and also involvement in the gastrointestinal tract, the liver, the spleen, that sort of thing. Histoplasmosis, like blastomycoses, also can affect the bone in both species. And so, as I mentioned before, in some cases, if we're struggling to control the disease medically, we will sometimes consider actually removing that leg or that bone, depending on, again, where it's found in the body. It is often found in the soil, primarily in the Midwest and the Southeast. It is diagnosed probably best either with the antigen blasto test that we talked about. It can also be diagnosed on cytology or biopsy. It also can be diagnosed with DNA testing, or kind of unreliably, it can also be diagnosed by antigen testing using a different technique called ELISA, which is an enzyme test. Treatment for this disease often involves, again, oral antifungal medications, or in some cases injectable therapy. And again, treatment, we usually want to treat beyond resolution of either the clinical symptoms, the imaging findings, or ideally if you could detect it with either the DNA testing or some other modality to just make sure that it's gone. In some cases, we end up treating lifelong, and again, in that situation, what we think is happening is that with the drug, the immune system is just able to keep it under control so it doesn't cause any clinical signs to the patient. Cryptococcosis or Cryptococcus is the last fungal organism that I want to talk about. This is a fungus that actually is present throughout the United States. It's found in actually bird poop and also decaying plant material. We will see it often in cats that don't even go outside and don't have any exposure to birds. So in some cases, it's questionable maybe how it gets into the house, but we certainly do see it. It typically causes either skin symptoms like skin changes. Most often we'll see upper respiratory symptoms. We also can see changes with regards to the neurological system, so symptoms of brain disease or neurological deficiencies. We also can see that it affects the eyes as well. In most cases, in kind of my practice, I typically see it more in cats in the upper respiratory system than anywhere else. A lot of cats will present with a lot of nasal discharge, or in some cases they can actually develop what's called a Roman nose, but basically a swelling over the bridge of their nose. Cancer would be another differential for that, but we do see that is kind of a classic textbook symptom of Cryptococcus in cats with upper respiratory symptoms. In a lot of cases, how I diagnose it is with rhinoscopy, where we basically go into the nasal cavity with a camera. I like to start with a CT scan so that way I can get a lay of the land, get slices all the way from the tip of the nose into the brain, and that can be really helpful as far as prognosis to know the extent of disease, and if it does involve breaking through the separation between the nose and the brain, is it affecting the brain, because that definitely changes the overall outcome. We also can diagnose Cryptococcus either with cytology or biopsy. So as I mentioned, when we're doing the CAT scan and the rhinoscopy, the way that we typically pick it up is on the biopsies or sometimes culture. We also kind of less invasively can do an antigen test, actually looking for a portion of the fungus either in the blood or actually the urine. It typically does not cause an antibody response. This organism is it protects itself very well and protects itself from recognition by the immune system, so doing antibody testing is not very helpful. And then DNA testing can always be done as well. Treatment for this fungus involves oral antifungal medications, injectable antifungal medications. Even though we talked about nasal disease in another part of this fungal lecture series, we talked about topical treatments for patients with aspergillosis. This is not a fungus that we do that, so we're usually using systemic medications because we worry that it can potentially go systemic. If it does enter the central nervous system, the prognosis at that point becomes very poor. And just like with every other fungal disease that we talked about, we want to treat for at least 6 months beyond, ideally a negative antigen test, or imaging if that's repeated. We want to make sure that everything's completely gone, and so that's why we treat a little bit longer than even when the last trace of the fungus is gone. In some cases, again, this is a lifelong disease that needs to be treated. And again, what we think is happening is that with medications, the immune system is able to just keep the fungus in check enough that it doesn't cause any major problems for the body. But if you were to withdraw the antifungal medications in that situation, then the immune system can't keep it under control and it would come back. So in some cases, what we'll do with the antigen test is also using it to detect whether or not there's a remission. These fungal organisms, as I've mentioned, we've talked about several, and none of them at this point have any sort of danger for the person taking care of the patient, unless for some reason you're growing fungus in your house. If you're culturing it yourself, the fungal spores will actually develop, and that could be a risk to you and your family. But just having your pet around, even if they're having nasal discharge, there's really minimal risk to you because what is being shed and those secretions aren't infective. Now, the caveat with that is if you have immunocompromised people, there's always a chance that these organisms can take advantage of that. But again, typically how I'm counseling my patients, my clients, that have pets that are going through fungal disease treatment is there's minimal risk to you. And same when these pets are hospitalized and come into the hospital to my technicians, we always use precautions with any pet, hand washing, gloves, that sort of thing. But again, the stage and the form that the fungus lives in the body is different from what's infective in the environment. And so again, unless you're culturing it, the risk is very minimal. I hope you enjoyed this series. Please subscribe if you like this. Leave a comment. Let me know what ideas you like, how you enjoyed this video. I look forward to seeing you in the next episode. Thank you.